I'm very excited to talk to a close friend and a doctor of 57 years. We've been close friends for about 25 years, Dr. Monica. Welcome, Dr. Monica. Now, Dr. Monica was one of the first doctors that started to practice integrative and holistic medicine. And through the 25 years of knowing Dr. Monica, we've done talks in certain parts of New Zealand. You've written lots of books and made lots of DVDs, which I've helped you with. Your late husband, Dr. Gerald Lewis, awarded the Who's Who, the International Who's Who of Medicine. And the purpose of this interview really is just to have a chat about some of the history and some of the challenges that you went through with the medical industry, because probably back in the 70s, it was very unusual for you to practice holistic and functional integrative medicine. Would you like to tell us a little bit about that?
Well, for a start, there were only 8 doctors in my year, women. The rest were all men. And we got a pretty hard time in that time. And one of the things that I remember is in my final exam in orthopedics, I walked into the room and was told to get down on my knees. And I said, "What do you mean?" And I was told, "You get down on your knees and you're going to stay there all during your exam." And I had to do that. And I was looking at all sorts of things, ankles, toes, feet, in my orthopedic exam. Now, you would never do that today. And the arrogant, rude doctor who was in charge just wouldn't be allowed to do that now. We had a very hard time. The girls particularly were often put down. They were made to feel small. They were often given really rather ridiculous things like that to do. And you got to be quite tough in these areas.
And so from there, what have you and Dr. Gerald experienced?
We've both grown up being a little bit different. We wanted to spend more time talking to patients. I, for instance, could not fit my appointment into a quarter of an hour. Even today, a lot of patients are only seen for 5 minutes. And so I chose to bow out of conventional medicine, and I set up a new clinic working with people who I saw for the first time for an hour and a half. And I wanted them to talk to me. I wanted to hear their stories of their lives. And most of these people were on 15, 16 more drugs. And because every time they'd gone to the doctor with something, they'd been given a drug. Another time they'd go months later with a different condition, get another drug, and so on until they had this great plethora of drugs. And nobody actually looked at all these drugs together and said, well, a lot of them are causing your problems. And so I started having this holistic practice for chronically ill people. And I was very, very, very busy. I very rarely saw a person more than 2 or 3 times because they were getting much better. And what I did a lot of the time was I stopped quite a few of the medications. We talked about their conditions and the things that were important to them, and people went away feeling very much better.
That must have attracted some attention of the medical industry, did it?
Yes, it did. And I got quite a bit of flack from other doctors. I was in partnership with another doctor, and he said one day, "Right, well, we're going to start charging 2 or 3 times if a person comes in with 2 or 3 things." And I said, "You can't do that because you can't treat a whole person like that." And anyway, to cut a long story short, we decided to part company because he couldn't understand how I was thinking.
And tell me about Dr. Gerald.
Dr. Gerald was a fully trained invasive cardiologist to start with. He trained for 14 years after he qualified. And he insisted that he wasn't just a cardiologist, he was a specialist general physician as well, because he said you can't just treat a person's heart. So he was actually doing the same sort of thing as I was, looking at widening his interrogations and his interest in patients. And as a result of that, he went overseas quite a lot. He was interested in different sorts of medicine, and he was doing lots of different things. One thing that happened was one of the drugs he was using for people with heart failure noticed that they got their blood pressure falling. And he noticed that it always fell in these people. And he talked to the company who made the drug, which was a German company. And he said, this drug is very good because it's got no side effects. And I think it should be used for lowering blood pressure. And they said, no, this drug is for heart failure only. And that's what they did. But my husband was quite sure that there was a big use for it. So he did his own study, and all medical studies are funded by drug companies. He funded his own study and proved that this drug was very, very effective and safe in people with high blood pressure. And so much so that the company that made the drug eventually looked at it and said, oh, well, perhaps you're right. And they paid for him to go overseas and lecture around the world in it.
And can you explain some of the titles that he has earned?
He was regarded very well by lots of people. In Napier, when we left Napier, he was awarded the keys to the city by the mayor, and a big thank you for all he had done for the city. He was given the who's who for medicine for 1 year because of the work he'd been doing in heart failure and high blood pressure medication. And that is very rarely given to New Zealanders. He was awarded a number of other prestigious things as time went by too.
So was it all smooth sailing for him? Because he was obviously very innovative.
Yes.
But did he run into any stumbling blocks in terms of him trying to really help his patients?
Yes, he did. And that happened quite a lot in his later years. And it was time when he was doing a locum, and he was working in Tauranga Hospital, came in, and there was a very badly unconscious patient. He'd been unconscious for some days. And my husband said, let's give him intravenous vitamin C, because he had an infection. And the man recovered. But he was only on for this weekend. And the doctor who came in on Monday said, oh, this is ridiculous, and stopped the intravenous vitamin C, and the patient went unconscious. The next weekend, my husband was on again. He gave more vitamin C, and the patient recovered. And the patient, by this stage, was getting very frustrated, and his family took him out of hospital, took him away, and used intravenous vitamin C a lot over the next week. And he recovered. And a fortnight after that, he invited my husband to go on a tour of his big farm. He had a big farm, and my husband was taken in a helicopter around this farm to look at all the things that this man was now doing. He worked in this clinic that he'd been headhunted to go and run for a number of years. And then one day, to everybody's surprise, some people came on and said they were closing it down. They had decided that it should be closed down because it wasn't making enough money. In actual fact, they had made more money than they had borrowed, and there was really no need to close it down. But it was closed down with a lot of negative publicity by the cardiologists in Auckland, who said the treatment that this clinic is using is dangerous. It will cause cancer, it will do lots of different things. And they took pages and pages of the front page of the Herald every day of the first week that the clinic was open. And it was very, very sad. And we lost all our equipment. All the things that we had used in the clinic were confiscated by the receivers.
So the medical industry really used a lot of propaganda because probably they knew it was actually working, because there were lots of reports of people becoming well.
Yes. And what was even worse for us was the clinic had a big heart scanner, which was doing a wonderful, wonderful job. It was the first one in New Zealand. And the other doctors in Auckland were saying how dangerous it was. And after the clinic was closed, they purchased it for a 10% cost. And it's still in Auckland today.
But Dr. Gerald taught a lot of other cardiologists. Surely there would have been a group of cardiologists that would have backed him up.
No, not at that point, no. I think people saw that these other doctors were very powerful.
Yeah.
And they also stressed that Dr. Gerald, as they called him, was inferior in his medicine, and he was now doing bad things and this sort of thing, which was very sad.
That would have been extremely stressful for you guys.
Yes, it was.
Did it? What did that do to your faith in the actual medical industry itself?
We'd always been pretty sceptical about the medical profession because a lot of them were trained in very narrow conditions, like the cardiologists that only know about cardiology. And nowadays, there are a few who are wider based, but back then there weren't so many.
So what did you do, Dr. Monica? Like, obviously you were taught a very narrow thinking potential in terms of where you have to practice in medicine. You realised it wasn't helping your patients, so you've expanded your time, and also you'd had to expand your knowledge. So what sort of things did you do?
Okay. Well, that's a good question. And I realised quite early on that I didn't know everything, but I noticed one or two interesting things. And when a lot of women came to me with depression and talking about having great rages in the week before their period, I thought to myself, this is funny, because these women are, the week before the period is when the progesterone is supposed to be at its maximum, and progesterone has a calming effect. And I discovered that most women had abnormal hormones. And so I started to look at the hormones, started to analyse them myself, think about them, and then started to treat patients not with estrogen, which other doctors were doing, but with progesterone, which was a feel-good hormone, and with great results. And I went on from there to realise that a lot of what we were doing in medicine wasn't quite right. And I talked about the drugs that people were taking and the massive amount of them. And so I gradually developed my confidence and decided to cut people down on their drugs as well.
I think it's particularly today, we're in 2025 now, and I think more and more people are realising that the medical industry are more about treating the symptoms and not the driving forces. But back in the 70s and 80s, when you were practicing yourself, you would have been possibly a subject of, quite a bit of ridicule, particularly in the medical industry.
Yes. And I got a little bit less than my husband. My husband was a bit more out there, I guess, and he got quite a lot of flack. I didn't get quite so much, but people were surprised by my way of practicing medicine, and they would often question me and say, how can you do this? So
I suppose you would have been finding that a lot of your patients would have been coming off some of the drugs. I'm sure that would have raised some red flags for the medical industry, did it?
Yeah, it did. But I found that people you could reduce the medicines to about 3 or 4. Yeah. And I would do it slowly, gently, with the patient's permission. And I listened a lot to patients, what they wanted.
Now, you and Gerald, you travelled the world giving talks, and you, in fact, you and I and Gerald, we've done talks together in the South Island as well. And I can remember, some of your meetings attracted 900 people, but I think we had one in Queenstown with 5 people. I think that was the wrong day to do it. But I was always really impressed with how people were shocked with the information that you guys would both communicate. And it's becoming, because of social networking, Facebook, TikTok, more and more doctors are starting to get the courage, and it's becoming more accepted, the fact that I think we're not really dealing with health the way we should be when it comes to orthodox medicine. What do you think you'd like to see in the future?
Yes, I think that that's true. People are not happy with the way medicine is going. It's getting to be very difficult to get into doctors. That is causing a problem. But more and more people are realising that doctors haven't got the full answer, possibly because they haven't got the time. And it's really great when I see clinics like Brilin giving a wider range of options to people. It's really exciting.
I'm always careful not to demonise doctors. A lot of people do. The way I see it is, first of all, it's not the doctor's fault. I think doctors have really good intentions, but they have been taught to be within a certain box. And if I got hit by a car, Monica, I wouldn't want someone on the holistic side to come and look after me. I would want St John Ambulance. I'd want to go into a hospital, and I'd want a proper doctor to look after me. So we do need a medical industry. It's just that there's just, maybe a bit too much focus on using drugs to mask a symptom. And again, as you mentioned, just not enough time to take the full picture. What are the driving forces behind disease? If there's a lump and a bump, there's probably no wisdom in actually treating the lump and the bump. It's actually, why is that lump and bump there in the first place? What are all the contributing factors? And obviously, you and Gerald, friends, mentors, learned a lot from you guys. You've written books on cancer, supplements, many books, and I even helped with the early stages of producing DVDs on children's health, all sorts of things. And and sometimes I'm looking at new information that seems to be released now, and I'm thinking, well, wait a minute. Dr. Monica and Gerald covered that sort of 20 years ago. So it's not new information. It's just that a lot of the holistic information has been suppressed quite severely over time.
Yeah. I think you're right. I think when people are acutely ill, they really need acute medicine quickly. And that medicine has been very good. And it's very thorough. And I have no problem with it. It's the chronic conditions that are suffering badly.
Because it doesn't make sense that we've got this medical industry with trillions of dollars, so much research, so much modernisation, yet chronic disease is increasing at an incredible rate compared to beforehand.
Yes.
Why do you think that is, do you reckon?
I think the medical profession is getting very bound into a small box. They've got a lot of administrators, people like that, who are really making life very difficult for them. I'm looking at the practices where I live now. Very few of them have got enough doctors. They're all stressed. I was given an appointment recently for an urgent appointment for 3 weeks' time. When I went in 3 weeks' time, I was given an apology. My doctor was not well. Could I come back in 6 weeks' time? I went back in 6 weeks' time. I was told, oh, I'm sorry, we still can't see you. Now, that sort of thing is happening. It's not the doctor's fault. The doctors are working over the top. They are being traumatized, I was going to say. Maybe I can say. the patients are being, the doctors are being quite traumatized. I watched one doctor in my practice put on a lot of weight over a year and then left, and she couldn't cope anymore. And I think that's a real shame.
I've been really blessed by meeting many doctors through my journey who have become friends and in some cases clients, believe it or not. And I have witnessed them also being traumatized, by the gods above of the medical industry. And it's really not the way health should be. The more stress you have, the more disease you have. In fact, I believe probably stress is one of the root causes of many disease. And if it hasn't caused the disease, it will definitely hold that disease in there. As you mentioned in another video we just recently made about cortisol being an issue.
Absolutely. Stress is a huge one, and it's a really big one for doctors today. Yeah.
So were you born and bred in New Zealand, Dr. Monica?
No, I wasn't. I was born in China.
China?
And my parents lived there for 25 years in Yunnan province. It took 6.5 weeks to get there on camels and donkeys and things like that. My mother ran a big clinic and a big hospital, and she was on her own, except she had a visiting doctor once every 3 months. My father was doing a lot of translation and working among the poor peasants and in the area. And we had a couple of years at the end of that time under communism. And I really feel that the time that was so traumatic at the time, where I personally saw my parents' friends shot in front of me, and I walked into my bedroom and saw my room being ripped apart by 6 or 7 Chinese soldiers. That trauma struck me. I have amnesia for 2 years, but I think it built my confidence in my own ability as time went by, and I think that helped me in medicine long term. When we left China, we had to run away because we weren't allowed to go, but we had to go. And the American Army converted a Jeep with enough petrol for 2,500 mile drive. And we got in one afternoon and just drove to Hong Kong with no clothes, no food, nothing, just ourselves. And we had a long time there. Then we went where the ship was going, to the States. It was a big cargo ship, and the men and women were put half in the hold, half men, half women. My mother got both typhus and typhoid, and I, as a little 8-year-old, was able to run into my father to find out how to look after her. And I don't remember any of this because I had amnesia. But she nearly died going to America. And we were there for over a year. And then we went to Britain. And I was in Britain until I came to New Zealand when I was 21.
What motivated you to be a doctor, especially back then?
Yep. Well, it started off with a casual remark in my school when one of the teachers said, of course, you can't do something like medicine because our school doesn't do medicine, doesn't do sciences. And I had already thought maybe medicine would be nice, but that moment was when I decided that was what I wanted to do. And I said, but I am going to do medicine. And they sent me to the boys' school to do my sciences.
Wow. Wow. And where did you practice? Sorry, where did you learn your medicine?
I went to Charing Cross Hospital Med School. Yes, that's in London. And it's a big clinic. And then when I'd been, I did 3.5 years there, came over to New Zealand when my parents moved to New Zealand, and I finished in Dunedin.
How did you meet Dr. Gerald?
Well, that's a bit of a story. My first day in New Zealand, I was rather overwhelmed, and I was sitting in the back row, and the professor came in and said, today we're going to listen to hearts. And everybody turned and looked at the 8 girls in the back row. And because he wanted 2 people to strip to the waist. And I laughed because I thought it was funny, but that joke went on for half an hour. And I was thinking, I don't think this is a very good country for me. And then Jerry, who happened to be in the same year, was instructed to get undressed to the waist. So I didn't actually notice him in any other way, but he was sort of in my conscience. Yeah.
And then you met, developed a relationship, got married. And what about family?
And my family, I've got 3 daughters, and my middle one wanted to do medicine, and I tried really hard to dissuade her and pleaded with her not to do medicine. But she chose a field that I would never have thought of. She's an emergency doctor in pediatrics, and she's teaching the junior doctors in Australia and New Zealand who need to have regular training. And she's very happy.
Probably couldn't think of anything more rewarding as being an emergency pediatrician.
Yes, yeah, and it's a perfect field for her. She's in Starship Hospital. Mm.
And so, you're, as you said, you're in your early 80s now. And what sort of projects are you working on in the line of health?
Well, I'm really interested in the stem cell therapy that LifeWave make, the patches that they make. I'm interested in good quality supplements. I'm looking at lots of things that help people. And I still see people at home occasionally, even though I've tried to stop.
Oh, you probably could never stop being a doctor, especially someone like yourself, because, I've known you for nearly 25 years. And what struck me about you, you're always just such a loving doctor, such a loving person, both you and Jerry. And you've helped everybody. And I've seen it because you've even come down to our clinic many times. You've helped so many of my clients as well. You've helped us with a lot of knowledge in the early stages of the Brilin Centre. You're always giving without any expectation of return. That's something, I always remember about you. Yeah.
Oh, well, thank you. Thank you very much. Well, it's very much a gift to me because I love helping people.